In this video tutorial, we will demonstrate how a Massachusetts healthcare professional or delegate user can conduct patient searches in MassPAT, the proprietary system called PMP Aware. Note that other MassPAT tutorials address user account creation for prescribers, pharmacists, delegates, and medical residents with prescriptive authority. In this tutorial, we'll cover setting up your patient search criteria, reviewing and exporting your search results, conducting a patient search when you are unsure about the spelling of a patient's name, and conducting a search on multiple patients at the same time. For this demo, we'll log in as a prescriber user type, since the search features are essentially the same as for other healthcare professional user types. Logging in directs you to your user dashboard, as indicated by the orange highlighted subtab in the gray bar of the page header. To navigate to the patient search page, select the RX search tab in the blue bar, and then select the orange patient request subtab. But before we continue, notice the orange subtab labeled bulk patient search. We'll touch upon that useful feature a little later in this demo. Okay, let's go to the patient request page. This page presents form fields for inputting information for your patient search. First, let's look at one of the search features here. Notice the PMP Interconnect Search checklist on the right. Here is where you can control which additional states to include in your patient search results, providing the states are available to share data. Only a small number of states may be available to share data at the time MassPAT becomes operational. However, we expect many additional states to be available for data sharing soon after. So on this page, you can check off the states you want to include for a particular search. You also have the option, however, of setting defaults for states to include in all your patient searches. For instance, you might want to always include neighboring states, if they are available. To do that, navigate to the default setting page by selecting the User Profile tab in the blue bar and then the orange default PMPI States subtab in the gray bar. Here on the default Interconnect PMPs page, check off the states you want as your defaults, and then select the blue Update Defaults button at the bottom of the page. Once you do this and see the system's default states updated pop up, you can then navigate back to your patient search page by selecting the RX search item in the blue bar, followed by the orange Patient Request subtab. Notice on the search page that your default states are now checked off to be included in all of your searches. Of course, you can always uncheck default states on this page for conducting particular searches. Let's continue setting up this search by completing the 3 required fields under patient info indicated by a red asterisk: first name, last name, and DOB, or date of birth. Keep in mind that you can refine your search by completing the non-required fields such as patient phone and address. However, this is not recommended. Notice also that you have the option here of searching on the partial spelling of the patient's name. For example, if you are not sure how the name is spelled. We'll touch on that too later. Next, notice the range of prescription fill dates defaults to 1 year from the current date. That's because the system only supports searching prescription histories going back a single year. Again, you have the option of refining your search by narrowing the date range. Note that if you are conducting searches as a delegate user authorized under more than one primary account holder, the search criteria page will include a drop-down list where you will need to select which supervisor you are conducting this particular search on behalf of. Okay, now we can select the blue search button to run the search. Here on the results page, information about the patient's prescription history is displayed in 3 main tabular views: by prescriptions, prescribers, and pharmacies, or dispensers, with summary counts of the records in each of these tables near the top of the page. 2 other data points highlighted in the summary row are a count of the patient's private pay transactions, that is, payment by cash, check, debit, or credit card rather than with commercial insurance, and a count of total morphine milligram equivalents for prescriptions that are still active, based on the total quantity and days supply shown in the prescriptions table. Now note that selecting the arrowhead control to open the patient name accordion panel just above the summary row presents the patient or patients that match your search criteria, which is also shown in this panel. For instance, if no address information was included in your search criteria, the results will include records for a patient with the specified name and date of birth, but who is listed at various addresses. Each of these variations will be listed here with a unique ID number, which is also displayed in a column of the prescription table. Another important feature to notice here is that the system search algorithm is designed to be somewhat expansive by including near matches on the first name that you specified in the search criteria. For instance, by including records with such variations of a first name as Stephen, Steve, and Stevie in the results. Note also that when search results first display, if PMPI states were included in the search, the page will load initially with Massachusetts results, while continuing to search for data from the network states before refreshing the results. This ongoing processing is indicated by a timer element and pop-up message just above each table view. Now let's look at the first of the three main results tables, the one organized by prescriptions. This table includes such information as what drug was prescribed to this patient, when the script was written and filled, who wrote the prescription, and what pharmacy filled it. The default sort order is the prescription fill date, starting with the most recent. However, you can resort the table by clicking on any column header. For instance, you might want to select the ID number column header to sort the table by the various patient matches found, or sort the table by type of drug prescribed. You can also drill down into some table columns by moving your mouse over an individual table cell to open a pop-up. Do this, for example, to obtain the full name, address, and phone number of the prescriber or pharmacy associated with the particular prescription. Or do this to access details about payment type. Now let's take a quick look at the next search results table. Note that you can expand or collapse any of these accordion sections by selecting the arrowhead next to the section header. This second table lists prescribers in alphabetical order by default when there is more than one, who wrote the prescriptions that were found in the search, and it provides each prescriber's address and contact information. Here too you can resort the table by clicking on any column header. And lastly, the dispenser's search results table. This one presents key information on the pharmacies that filled the prescriptions identified. In addition to viewing your search results online, you can also export it either as a PDF or CSV file that can be opened in Excel. To export, simply select one of the output icons just above the results grid and to the right. Output to PDF, for example, includes the patient's name and date of birth, the date range for the prescription history records found, and a date stamp for when the MassPAT search was generated. Now let's go back to the page for searching on an individual patient to consider a situation where you are unsure about the correct spelling of a patient's name. To get there, we'll select the orange Patient Request sub-tab. You'll remember that earlier we noted the checkbox option here for searching on the partial spelling of the patient's name. Now let's try it out by inputting partial first and last names, selecting the adjacent checkboxes, and also inputting the other required data element, the date of birth. For a partial name, you must input a minimum of 3 letters. Note that when you select the partial spelling option, the multi-state search feature is unavailable, and so the PMPI list is no longer displayed on the right side of the page. Okay, now let's add in the last bit of required information before running a search, the date of birth. Okay, let's run the search. Notice that the system first displays a list of possible matches to the partially spelled name and presents a link for going back and refining your search. In this case, the system found just one patient match, and that looks like the correct street address for our patient. So let's select the record and run the report. Okay, here's the patient's prescription history search results, which you could now explore and export. Instead, let's continue on to another important search feature of the MassPAT system. As mentioned earlier in this demo, The MassPAT system also has an option for searching on multiple patients at the same time, the so-called bulk patient search feature. Let's explore this briefly. To get to the page for conducting this type of search, we'll select the orange Bulk Patient Search subtab. So for example, a doctor's office could use this feature to search a list of patients scheduled for appointments the next day who might be prescribed pain medication. Notice the bulk search page presents two approaches. One where you manually enter patient information and then select the blue Add button to open input fields for each additional patient to be searched. The other approach is to upload a spreadsheet file of patient information based on the downloadable sample file provided. Run validation on the format of your uploaded file and then run the bulk search. With either approach, you also need to give a group name to your bulk search further down the page so that the system can keep track of it. Also, same as when setting up a search on an individual patient, you have the option to refine the search date range and to include additional states in the search. Notice too that there's an accordion panel below. Here the system keeps track of your bulk search history so that you can retrieve or refresh the search results, and so you can monitor bulk searches conducted by your delegates. Now let's very briefly touch on a feature that allows a prescriber to search on scripts that have been written within the past year under his or her DEA number. To run this type of search, the prescriber would select the RX Search tab in the blue bar, and then the orange My RX subtab. This capability is useful, for instance, if a prescriber suspects someone has stolen his script pad or DEA number and is writing unauthorized prescriptions. On this page, the prescriber would input a date range and optionally a specific drug name and then run the search. If we ran this type of search, we'd get a list of prescriptions written accompanied by patient and pharmacy information. And now we'll move along and wrap up this tutorial. To wrap up, let's go back to our user dashboard. Here's where you have access to searches you've recently run, in case you want to go back to the results. That is, by selecting the patient name. Also, if you're a primary account holder, for instance, a prescriber or a pharmacist that has delegates authorized by you to run searches in the system, their searches will be listed here in a separate table. Finally, to close out of the system, you must select the Logout tab in the blue nav panel. Okay, this concludes our demonstration. You should now be able to run prescription history searches in MassPAT on individual patients and groups of patients, know how to explore and resort the search results, and be able to export your search results. Should you need assistance in using the system, call the APRIS Help Desk phone number that appears at the top right of every page of the system.